unlimited budget first, and then limited budget second. If we could test ourselves for three things, what should we be testing for ourselves for in Sniper's Alley between the ages of, say, 40 and 60?
Yeah, it's a good question. You know, I think, Chris, the first thing you'd want to do is, if you were going to really be limited to three things, you'd want to get a really good sense of your family history to know what things might be of exposure. So, for example, if you knew, for example, that your father, uncles, grandfathers had prostate cancer, you would really over-index on doing more of a thorough examination. And if cost were no object, in addition to doing very standard things like PSA and looking at not just the PSA number, which by itself is not particularly helpful, but looking at the PSA density and the PSA velocity, you might say, look, I'm going to splurge on what's called a multiparametric MRI, which is really the gold standard for looking at the prostate. Similarly, if you're a woman and you have a family history of breast cancer, you would really index and say, look, not only am I going to get my mammogram, which is helpful for certain kinds of breast cancers, namely those that are calcified, but I'm also going to get this multiparametric MRI, which complements the mammogram perfectly. If you knew, for example, that someone in your family history had colon cancer, or you were at risk of it because of inflammatory bowel disease or things like that, you would probably say, look, I'm going to make sure a colonoscopy is high on that list.
Yeah. That's on your list.
Yes.
You've had three of those so far?
I have, yes.
Yeah.
I think there are a couple of blood tests that are relatively inexpensive and should be on the list for everybody, and I would hope that they wouldn't encroach on that top three list because they're relatively inexpensive. So everybody should know their ApoB, and everybody
What is ApoB?
ApoB is a blood test that is explaining the concentration of what are called lipoproteins. These are the particles that carry cholesterol, and the ApoB lipoprotein is the one that causes heart disease.
Okay.
So the number, that ApoB number, literally represents the concentration of bad actors in your blood that carry cholesterol into the artery wall.
And cancer often gets the headlines quite rightly, but the red ribbon, as you refer to, as opposed to the pink ribbon, doesn't get as much, but is the biggest killer.
It absolutely is.
What are the four biggest killers?
In order, it would be heart disease and cerebrovascular disease, far and away number one, followed by cancer, followed by neurodegenerative disease. And it depends. Technically, you would also include chronic obstructive pulmonary disease in there as the fourth. And the reason I don't spend a lot of time on that is that's almost exclusively associated with smoking. And in many ways, this analysis I'm putting out is for a non-smoking population, because generally a smoking population doesn't come to this argument with the same passion of, hey, I'm doing everything I can to live longer. And then we would sort of say, then the fourth would be these metabolic diseases of non-alcoholic fatty liver disease, type 2 diabetes,
Yeah, you had a wake-up call with the old fatty liver disease, because you thought...
I didn't have fatty liver disease, but I was very insulin resistant.
Sorry, no, I'm referring to the patient that
yes.
Do you remember, can you just recount that story?
Sure, yeah. So today we know that fatty liver disease, non-alcoholic fatty liver disease, is very prevalent. And I'm sorry that I don't know the stats in the UK, but in the United States, it's well on pace to become the leading cause of liver transplantation. What it is fat accumulation in the liver that is not driven by alcohol.
It looks the same.
It looks the same. And the story you're referring to was a little over 20 years ago when I was in my surgical training and we were operating on a patient. And this was actually right when I was a very junior doctor. So my job was to what we call pre-op the patient, which means just learn a bit about his medical history. And one of the more important things you want to learn about a patient before you operate on him or her is how much alcohol they consume. Because someone who drinks a lot will have some complications with anesthesia and post-operatively. And you just need to know that so you can manage it medically. This patient said he didn't drink, so I left it at that. But when we opened him up to remove his cancerous colon, he looked like his liver was just a ball of fat. And that was a bit of a wake-up call because, of course, the initial assumption was he had lied. Later realized, no, he had not lied at all. This was non-alcoholic fatty liver disease, which even 22, 23 years ago when this happened was almost unheard of. In fact, I didn't really come to understand what this was until about 15 years ago.
And with him, was it fizzy drinks with him?
Yeah, probably.
My goodness me.